Poor blood pressure control may be due to a number of reasons, but in this video I'll be sharing with you 7 common reasons for poor blood pressure control. Are you a known hypertensive, or you know someone that is? Do you actually care for someone that is a known hypertensive? Then you need to watch this video to help yourself and or to help someone close to you. So at the end of this video, you will come to realize 1 or 2 reasons why your blood pressure or the blood pressure control of that person may not be controlled. Of the 7 common reasons for poor blood pressure control, the first and the most common is non-adherence to medications. Non-adherence to the blood pressure medications. If you have been diagnosed of hypertension and your doctor has prescribed antihypertensives for you, if you miss your dose of antihypertensives, or if you do not take it at all, then you are not likely to have a control of your blood pressure. So the way forward, what to do is to ensure that you take your prescribed antihypertensives as advised by your doctor. Your adherence actually talks about your behavior, your attitude to your doctor's advice on taking your medications. So you need to ensure that you take your antihypertensives to have a good control of your blood pressure. Okay, so you can actually set your alarm. Preferably your antihypertensives should be taken in the morning, and you don't necessarily have to eat before you take your antihypertensives. I hear a lot of people say when they come to the clinic, I have not taken my medications because I have not eaten. If you are not a non-diabetic, if you are not being managed for any other medical condition that requires that you eat before taking medications, then your antihypertensives can be taken without food, with or without food. But what is important is that you monitor your blood pressure. Ensure that you monitor your blood pressure. So to help yourself, you can set your alarm. You may set it to something like 7 a.m. or 8 a.m. and that will help you to be regular. You can even call the attention of someone who can help to check on you and support you on this journey. Yes, on this journey, because once you are diagnosed of hypertension, more often than not, you actually need to take the medications for life unless reviewed by your doctor for you to stop. The next reason why your blood pressure may not be controlled is closely related to the first, and that is incorrect dosage. There's a difference between dose and dosage. The dose means the quantity of the medication that you need to take, while the dosage describes the quantity. It's more expansive. It also talks about the frequency and then the duration of the medications that you need to take. So if you are taking your medications incorrectly, then you are not likely to have a good control of your blood pressure. So the solution is this: get your prescriptions right. What dose, what medications has your doctor prescribed, and how are you expected to take them? Get this correctly at your next clinic appointment. Okay, so that will help you a great deal. Knowing your dosage, being regular with your dosage will help keep your blood pressure in control. Next, the third reason why your blood pressure may not be controlled is drug interaction. Drug interaction. Now, as an individual taking antihypertensive, you need to know that there are some other ways that your drug may react or interact with other medications that can cause your blood pressure not to be controlled. This drug interaction may be divided into drug condition interaction. I will explain what I mean by that. Next is drug food interaction, and then lastly drug-drug interaction. When it comes to drug condition interaction, for example, do you know that if you take nasal decongestants about the time that you take antihypertensive, you are not likely to have a good blood pressure control, because some nasal decongestants like those that contain pseudoephedrine, that's a particular substance in the nasal decongestant, may also cause the blood vessels, not just of the nasal region, to be constricted, that is under pressure, and that may also affect other blood vessels that will lead to an increase in your blood pressure. So you may need to avoid taking such nasal decongestants when you are taking your antihypertensive. Next is drug-food interaction. As a non-hypertensive, you need to know that there are certain foods that may actually worsen blood pressure, and these are certain foods, especially as found in fast foods, in canned foods, and in seafoods. Even if you don't take many of these, but you cook at home and you add a lot of salt to your meals. In fact, some people add table salt to their meals even after being served, which is not good. So drug food interaction means that as you are taking your antihypertensive, you are also taking high salt diet. That will not help you to have a good control of your blood pressure. Next is drug interaction. There are certain medications that can actually cause your blood pressure to still increase even if you are taking your antihypertensive. Now, this is a common one in our environment. A common drug or medication that people use is actually an over-the-counter medication, is non-steroidal anti-inflammatory drug. For example, ibuprofen. This is also a known drug to cause blood pressure elevation. So you may need to avoid this and other non-steroidal anti-inflammatory drugs if you are non-hypertensive. Those are the important things you need to know about drug interaction to have a good blood pressure control. Now, what to do? As mentioned, there are certain medications that can cause your blood pressure not to still be controlled even though you are taking your antihypertensive. So avoid those medications. There are certain foods that may still cause your blood pressure to be poorly controlled even while you are taking your antihypertensives. So avoid such. There are certain medications in certain conditions, certain routes like nasal congestants that I mentioned may still cause your blood pressure to be poorly controlled. Hope you got that. Okay, if you need to, you may play this part over again. Next point, that's the fourth reason why your blood pressure may not be controlled, is poor lifestyle. Factors like diet, exercise, other social factors like smoking, alcohol intake. If you have a poor dietary lifestyle, you are not likely to have a good control of your blood pressure. What I mean by that is that you are expected to do mostly 50% of your plate as fruits and vegetables, 25% as protein, while the remaining percent should actually be carbohydrates. That's 25% of carbohydrates. Have you been doing that? Okay, I'm sure you have been advised by your doctor or dietitian at different times on how to use your diet to control your blood pressure. So apart from reducing your salt intake, you also need to have a balance on your diet. Another factor is alcohol intake. Some people take alcohol. Alcohol has been identified as a risk factor for developing heart-related conditions, including hypertension, and then it can also lead to other medical conditions, which we'll be discussing in subsequent videos. Smoking is another risk behavior that may cause poor blood pressure control, as smoking tends to affect the blood vessels and then may trigger hypertension. So note this: if you are hypertensive, you need to stop smoking, you need to avoid alcohol, and have a balanced diet. Lastly, sedentary lifestyle. If you are not actively moving, you should have at least not less than 5,000 steps in a day. In fact, if you can go 7,000, if you can go 10,000 steps in a day, there is the step counter that you can use on your phone to count your steps. sedentary lifestyle is now the new smoking, and there are certain risk factors that we know are associated with smoking. So if you sit all day not exercising, in fact there are indoor exercises that you can do, and I have done a video on indoor exercises that you can do using your chair, even in the house. That will help you to have good weight control, help you to deal with obesity if you have been diagnosed of that also. When you have these factors under control, then you can have good blood pressure control. I believe you are following closely and getting the point. Now, if you are yet to subscribe to my channel, we talk about health, wellness, and lifestyle. You can kindly subscribe right now so that you can get notified whenever I upload new videos. And remember to share this information with someone around you. Now, the fifth reason why you or someone close to you may not be having good blood pressure control is what is called secondary hypertension. Maybe due to secondary hypertension. Secondary hypertension is hypertension that is caused by other reasons. Major cause of hypertension is known as primary, which is essential hypertension, caused by different factors that I've mentioned as part of the information in this video. However, there are certain people, for example, young age group, that develop hypertension from other causes. For example, somebody may have extra kidneys, and that may predispose them to having secondary hypertension. Others may have multiple, we call polycystic kidneys. Others may have some syndromes associated with the adrenal function. There are other certain medical conditions that can predispose the person to developing hypertension. So for this, you need to have a very good evaluation by your doctor to be able to determine if the reason for this poor control of blood pressure is from secondary hypertension, and the underlying medical condition should be treated for you to have a good control of your blood pressure. The sixth reason why your blood pressure may not be controlled is what is called white coat syndrome or white coat hypertension. This is elevated blood pressure when you are in the doctor's office. Have you experienced that before? You are at home, you check your blood pressure, they check for you at the pharmacy, or a nurse checks for you, and you know that you have had good blood pressure. However, when you get to the hospital and you see the white coats, out of anxiety or fear, then your blood pressure may actually rise. So when this happens, we need to have a good measurement of your blood pressure at home. So your doctor will request for home blood pressure measurements over a period, so that will help to determine whether it is white coat hypertension you're having, which just requires counseling and support. Lastly, the seventh reason why your blood pressure may not be controlled is resistant hypertension. Resistant hypertension is elevated blood pressure even when an individual is taking 3 or more antihypertensives, yet not having a good blood pressure control. So what this needs is to have a thorough evaluation, thorough review by your doctor and other specialists that may be needed to manage your blood pressure. That is it. You have 7 common reasons why your blood pressure may not be controlled. So let me know in the comments section if you or your doctor has been able to identify one of these reasons why your blood pressure has not been controlled. You can share your experience with us. How have you been handling your blood pressure management as a known hypertensive? Or if you have questions, comments, any need for clarifications, then you can drop in the comment box. I will definitely respond to your questions and need for clarifications. Remember, these different causes I've mentioned are common. Managing high blood pressure may be complex, but with proper history, examination, investigation, in-depth evaluation of your health, you surely will be able to have a good control. High blood pressure management may be complex. However, identifying these reasons, making necessary changes as you work with your health provider will help you to achieve good blood pressure control. Remember to check with your provider, with your doctor for an individualized care, as this information sometimes may be general, but your doctor will be able to help you better as you interact with him or her. So thank you for watching. Remember, if you are yet to subscribe to this channel, if you are coming across my video for the first time, then you should subscribe so that you can get very valuable information on how to live a more healthy life. Thank you for watching. See you in my next video. Bye for now.